In this video, we are going to talk about the dreaded rotator cuff injury, something that we hear a lot about. It's walking in the door every single day. People are living their lives with this kind of thing. So in order for us to really dive into rotator cuff injuries and how we treat them here at CCRC, first we need to talk a little bit about the anatomy. So what is the rotator cuff?
Yeah, the rotator cuff is a very, very common injury that you'll see. And the rotator cuff is actually a collection of four muscles that sits around the shoulder. And it's actually underneath your deltoid. So this big muscle that you have right here, underneath that are these very, very thin but incredibly critical muscles that sort of control the shoulder. So they wrap around the arm bone, the humerus, and they actually manage controlling the positioning of the arm bone inside the shoulder socket as you bring your arm through sort of wide varieties of movement. Now, they're not very good at producing a lot of force. So if you're doing a bench press or you're doing like a pull-up or something, they're not creating the movement so much as they're making the micro adjustments to the joint to keep everything in a very, very safe and protected way. If they get damaged, which often happens, then your body's ability to keep your shoulder in a good position may be compromised, right? Now that doesn't mean that you're necessarily going to have some pain, but when you have a rotator cuff tear, that would be a tear of the muscle or the tendon, one of those four, then that oftentimes is going to give you symptoms like, it's very common to get symptoms down here or even into the shoulder itself. Sometimes you get sort of pinching when you raise your arm up, that'd be just shoulder impingement. Or there's a painful arc where you get here and it kind of hurts a little bit and then it goes away and then it comes back at the top sometimes. Just depends on which of the four muscles were actually damaged.
Yeah, so a little bit of good news, bad news. The bad news is many people are walking around with some kind of rotator cuff strain, tear, or dysfunction in that area. The good news is for many this is completely normal. So especially as we age, we may begin to see fraying or tearing in the rotator cuff. And just because we have that does not mean we have to have pain. And in reality, we see a lot of very high-performing individuals like those in the major league throwing with these issues, but it causes no symptoms. So very often we may see something like that on an MRI, but the individual may not actually have any sort of pain associated with it. So it's very similar to something like arthritis. We all have it. It's kind of normal aging. And just because you see that on some kind of imaging does not necessarily mean it's a surgical case.
Yeah, that's kind of understanding, sort of getting into nitty-gritty detail a little bit, but that you have sort of structural paradigms in the medical field and functional paradigms. A structural paradigm or a structural diagnosis would say, we're just going to look around and take pictures and figure out which is the most abnormal anatomy. Where's the structural damage? In this case, it would be a tear in one of the muscles of the rotator cuff. And then they assume that that tear has to get fixed if you're going to get rid of the symptoms, which is not true. The way that we sort of look at it more is we're of course accounting for structural changes, structural damage, but we're going to emphasize the function. And as Dr. Muse just mentioned, there are many, the majority of Major League Baseball players have torn rotator cuff. The majority of professional tennis players have torn rotator cuffs, and yet they have incredibly high functioning shoulders. So here, we're actually going to emphasize more the functional piece of it than the structural. It's not like that we ignore the structural one, but we just know, and there's lots of research to back this up, that you can improve someone's function in the shoulder, the low back, the hip, whatever, and despite having structural changes in that area, you can get them completely pain-free. I mean, I myself have a torn labrum on my right shoulder, and it functions perfectly well because I've rehabbed it. So the prognosis can actually be really, really good, despite the fact that it's incredibly limiting. Reaching across to grab, your seatbelt, or if you got to reach in the back seat of a car, or you're reaching up to a high spot, you might get some of that pinching there. But it's very, very fixable with rehab. So what would we do?
Well, like Dr. Ulm just mentioned, we have the structural and functional paradigm of where on the spectrum do people fall. And we're not going to sit here and say if there is a full thickness tear involving numerous tendons and the person can't even lift their arm above 9, well, then maybe that is more of a structural issue that we have to address. But that's something we're going to figure out through the exam and the treatment. So in this case, especially if we have some kind of structural deformation of that tissue, maybe there is some fraying, partial thickness tear, this is a case where we do need to be a little bit more on the isolationist side. And what I mean by that is very specific exercises that are going to target that muscle specifically to basically build strength and kind of force collagen laydown, or like the
Strengthening of the tissue.
strengthening of the tissue. But then something that we also always talk about is integrationism. How then do we take this shoulder, that this is the injured shoulder, maybe there's some fraying of that tendon, and how do we integrate that into overall function of the shoulder? So that's where we come in more with things like dynamic neuromuscular stabilization, but then pairing that with some really good specific exercise to target these tendons specifically.
Yeah, we have videos on dynamic neuromuscular stabilization, so faux pas for him to just drop it and not explain
Watch
it.
that
What-
video.
What he means by that is we're going to have cases where we want to strengthen the tissue itself, right? We want to make the muscle thicker, we want to make the tendon stronger so that it can do the thing it needs to do. But the other piece of it, that functional integration piece where we would use DNS, think of that as going to be more bigger movements, more, quote unquote functional movements, meaning they're very similar to what you might be doing in your everyday life. So we might have to teach someone how to sort of control their shoulder as they reach across their body. We might use a push-up motion or laying on their side or, getting in, on their hands and knees. These are bigger movements where we take the now newly strengthened muscle that we did with the isolation exercises, but now we're integrating it so that it actually does its job in your everyday life. So the good news is, or I guess the bad news is, you might have shoulder pain if you clicked on this video. That shoulder pain might be coming from a torn rotator cuff. The good news is the vast majority of shoulder rotator cuff injuries, even if it is diagnosed on an MRI, or if you've gone to your medical doctor and they said, oh yeah, you tore your rotator cuff, there is a huge percentage of the time that these are fixable things with these isolation exercises, and then also some of the integration exercises. So if you want more information on our functional approach, please click on one of the videos on dynamic neuromuscular stabilization. But hopefully you found this video useful, and hopefully you'll be able to get rid of your shoulder pain.
Yeah.
Thanks.